So I started to wonder about the role of sleep. I actually also struggled with migraines terribly all through the years, like since probably the age of 9 or 10, I had migraines, and I had surgery when I was 17. I was on every medication. I struggled with it for years. And meanwhile, I work in the healthcare setting. So I
Hmm.
had access to all the best drugs to help me with it, but I still suffered from migraines. Um, and it just so happened that one day, one of the nurses I worked with, she said, "Hey, I do the sedation for an oral surgeon at a dental office, and I'm going away this week, and I'm wondering if you would cover me." So I thought, okay, sure, why not? So as I'm sitting there, the patient's asleep, and I'm monitoring and I'm looking around the dental office, and I see a sign, a poster that says, "Ask your dentist about sleep apnea." And I'm thinking, well, sleep apnea is a medical issue. So why would a dentist have a poster telling people who come here? I looked at the dental offices, that's where I go to get my teeth cleaned before an event or I'm going on vacation, right? I didn't, and so I was like, why would you tell people to ask you about a medical condition as serious as sleep apnea when that should be sent to the doctor? So they started talking to me about the way that the tongue would fall back and occlude
Mm.
the airway, and that you could move it forward with this appliance. And that fascinated me. And I was like, how is it? I've never heard of this.
Mhm.
And so I started asking more questions, and this provider taught and he lectured around the world. So I started following him, taking all his courses, only to discover that in all my years of nursing and training and education, I mean, I even went back to my textbooks and I looked like, did I miss those classes somehow? And I looked in my big, thick textbooks, and there was like a paragraph, maybe two paragraphs about sleep and sleep apnea. And what we were advised to do as nurses is on night shift is group your care. So
Mm.
group your care so you're not going in and out, and you allow at least a 3 hour window of sleep, or at the very least an hour and a half. But you're kind of, that's all we learned about it. And so I just felt like all of these years without knowing that piece, all the people, I thought back of all the people and all the things they complained about and all the times we told them there was nothing wrong with them. But actually, they were all suffering from sleep apnea. All the people who
Mhm.
came into the emerge at night with palpitations, all the people who had metabolic disease, or depression or anxiety, and all those people, because we didn't understand and we weren't taught about sleep, we actually mishandled their cases. And so yes, it was a combination of my own sleep issues, my own headache issues, which I did not realize were connected. Um, and then my experience of working with patients and feeling like I let them down. And the more I learned about sleep, the worse that feeling got. And I'm in the emergency room and I'm trying to tell everybody that I work with, and they're all just really annoyed at me, because they're like, even the doctors are like, if what you're saying is true, we would have learned about it.
Mm.
And there's just no knowledge taught about it. So I thought, I'm gonna quit my job, travel the world, and scream from the rooftops, it's your sleep. And
Right.
thinking that that would be widely received, but it's been a challenge, but a very fulfilling challenge. So
Hmm.
long-winded answer to your question. Yes, yes, and yes.
I love that because I'm going to help you post it from the mountaintops here and let's
Thank
get the
you.
word out.